Hi everyone, my name is Severo Gonzalez, and this is my Population Level Health Education Intervention Project presentation. Introduction. According to the World Health Organization, or WHO, untreated dental caries, tooth decay, and permanent teeth is the most common health condition according to the Global Burden of Disease in 2019. The Centers for Disease Control and Prevention, or CDC, states percentage of adults aged 20 to 44 with untreated dental caries is 25.9% from 2015 to 2018. Also, the percentage of adults aged 18 over with a dental visit in the year 2020 was 63%. This indicates there is still 37% of adults in the US that have not been to a dentist throughout the year. Background and significance. For this study, the geographical boundaries will be the underserved, low-income, and homeless encampment located off the Interstate 10 freeway, north side, across the railroad tracks alongside Hargrave Street in the city of Banning, California. This community specifically consists of the city's homeless population and contains tents, cars, makeshift shelters, and camps. Apparent lack of dental hygiene was noted. Members of this community had missing or cracked teeth that were eroding, swollen gums, abscesses, and cavities. Mouth pain was routinely reported among this population. The community had expressed their concerns in how dental hygiene affects their everyday lives, such as sleep, coordination, and comfort. Others expressed how this issue had prevented them from employment opportunities and being treated differently among the general population. The overall goal of the Healthy People 2030 oral health objectives is to prevent and control oral and craniofacial diseases, conditions, and injuries, and improve access to related services. This includes reducing tooth decay in children and adolescents, increasing early detection of oral or oropharyngeal cancers, increasing use of the oral health system, increasing access to community water fluoridation, and reducing root surface decay in older adults. Needs assessment. In order to have a better understanding of community needs, a face-to-face interview was conducted. A simple interview consisting of 3 questions was asked. What necessities are you lacking in your everyday life? What changes in your community would you like to see? What is important to you? A total of 50 residents within this community were interviewed. Among those interviewed, the majority had expressed their concerns regarding dental care and hygiene. This need for dental care surpassed that of any safety or shelter among those interviewed. Changes the community would like to see are the available resources provided for the low-income population. According to the County of Riverside website, Community Needs 2019 Assessment Survey conducted on Riverside County residents, dental care was listed as the #1 need over any other issue. The survey consisted of 1,700 residents, which contains 63 questions based on personal necessities, needs, and concerns from financial to physical and psychosocial. This information as gathered by the 2019 Community Needs Survey dictates that dental hygiene and available resources are lacking within the local community and local county as well. Theoretical framework. The Precede-Proceed model is a participatory model for creating successful community health promotion and other public health interventions. The model guided the project by first establishing community needs/wants in Phase 1 and then identifying the issue or cause in Phase 2. Phase 3 assisted with identifying influential behaviors enabling the cause, while Phase 4 focuses on intervention design. Phase 5 was implementation of interventions chosen. In this case, it was the health education program. Phase 6 evaluates the researcher's progress and ability to carry out said interventions. Phase 7 evaluates the initial success of efforts placed. Lastly, Phase 8 is an outcome evaluation that focuses on reassessment of the goals and interventions. Issues: education and practice. This issue causing a community need of dental care could be lack of resources and financial means to receive care. As observed during the windshield survey, this community lacked basic needs such as shelter, as evidenced by makeshift homes, tents, and living arrangements in their cars. Without the overall necessities in place for survival, other basic needs such as dental hygiene is placed elsewhere on the list of priorities for these individuals. Other issues noted upon assessment would be their choices in lifestyle habits that contribute to their poorer dental hygiene. Polysubstance abuse with tobacco products, illicit drug use, and diet habits are another contributing factor. In this community, behaviors and lifestyle choices appear to be influential within this group. Predisposing factors noted were knowledge deficit in dental hygiene maintenance, low self-esteem, and confidence in being able to provide these self-care activities on a daily living basis, such as their ADLs, and overall attitude and motivation. During conduction of the face-to-face survey, these factors were noticeable among the majority of the population. Other enabling factors are apparent mental health impairments, availability of resources towards this population, and physical capabilities among those without the means of transportation and/or physical disabilities. Intervention. The intervention devised consists of a health education program focused on community needs and targeted low-income and homeless population. This educational program consists of information regarding proper dental hygiene techniques, including monitoring for signs and symptoms of dental abnormalities. Pamphlets with visual indicators were offered to those attending for reference to follow during the presentation. The program will also provide its audience with local resources focused on financial assistance in dental care, information on local clinics that accept a wide variety of insurances, including welfare or government assistance programs. Vouchers were offered. These interventions meet the Healthy People 2030 objectives as stated, to prevent and control oral and craniofacial diseases, conditions, and injuries, and improve access to related services. By educating the population on proper dental hygiene and providing resources to them to seek dental treatment and care, it will reduce the number of dental oral diseases and improve access to care services. Budget. A prospective budget would consist of supplies and materials needed to mass produce pamphlets of information and rental costs to hold educational health programs to the local community. Resources are already available that assist with low-income individuals, and there is no additional cost in training organizations that are already equipped with the knowledge and resources to assist this population. Project evaluation and outcome measurement. The goals set for this project were to bring awareness and knowledge to the public regarding proper dental hygiene care and also provide them with resources available to them to seek proper care. Short-term goal evaluation consists of determining the number of applicants for resources and attendance to educational programs. Long-term goal evaluation would determine the overall continued need for dental hygiene care and treatment in the next few years. Results and conclusions. Overall outcome of education seminars towards the selected community has been unsuccessful upon evaluation. Possible reasons could include the community members' overall attitude and motivation towards seeking resources available to them. Eligibility factors and requirements to obtain assistance such as income, disability, and citizenship can impede obtaining assistance. Other factors include physical and mental impairments, transportation, and adherence to interventions. That concludes my presentation. This is a list of my references. Thank you for watching.